Hey, good morning. April is Autism Awareness Month, and so we wanted to bring you some really important information from our friends and partners at UTMB Health. Joining us today is Dr. DeFilippis. She is a child psychiatrist with UTMB Health. Thank you so much for being here.
Thanks for having me.
Yeah, so autism, we think of this month, we think of the puzzle pieces and blue and all of that, but what truly is autism? What is the definition of that?
So, Autism Spectrum Disorder, as it's called now, is a neurodevelopmental disorder that affects that you see first in during the developmental period. So, in childhood is when symptoms first show up. And it's primarily identified with by deficits in social communication. That's kind of the core feature of autism. But it also has additional symptoms that have to be there, including some repetitive, restrictive, either movements or patterns of speech. So it's a wide there's a wide variety of ways that it can present. I mean, that's why it is now called Autism Spectrum Disorder.
Mm.
And it's more than just what we used to say high functioning, low functioning. It is more like a color wheel. So kids may have different strengths in different areas and areas that maybe they need a little bit more support in.
Okay.
And so every child who has autism is very unique and it can look very different from person to person.
Okay, so that's kind of the spectrum. I like the idea of the color wheel, so that kind of helps give a better vision to that. So we hear on the spectrum, and then we hear something called Asperger's. What
Yeah.
is Asperger's, and is it the same as autism? How do they differ?
Yeah, so Asperger's disorder was or Asperger's syndrome was a term that was used prior to our diagnostic kind of Bible or manual. So the DSM is what psychiatrists use to diagnose various conditions. And Asperger's and another one, pervasive developmental disorder, not otherwise specified. It's a mouthful, PDD-NOS. Those were two other diagnoses that were alongside autism in the DSM-4. So I don't know the year exactly, maybe 2012, DSM-5 came out, and they decided to kind of put all of them under one big umbrella. So that's when autism spectrum disorder came about. So Asperger's technically is autism spectrum disorder.
Okay. Good to know because I think when we were growing up, I mean, at least when I was, like Asperger's was something you heard of more often
Mhm.
um, than autism. So you mentioned that autism happens in those developmental years. Can a child grow out of autism?
So the short answer is no. The diagnosis of autism and the core symptoms are a lifelong condition. What we can see in some children, especially children who get early interventions and therapy specifically, is that their adaptive skills can really improve. So they can learn better ways of communication and social interaction, and they can sometimes find different rules of engagement that help them socially, and so they can, with a lot of therapy, grow up and it can be really hard to pick up on their symptoms. And so by the diagnostic criteria, if you're going through them, they may no longer meet all of those criteria. And in fact, a study just came out showing that some kids who get those early treatments can, if you go through, the testing, can no longer meet those criteria. It doesn't mean that they no longer really have autism. It just means that they have kind of learned ways of adapting, that it is no longer as obvious when they're interacting with other people. Yeah.
I think that's so hopeful.
Yeah.
Especially, and I think that's why it's so important to continue to raise awareness about autism. Because again, like, are there more cases of autism now, or are we recognizing it better? So, um, let's say we're an older child or an adult. Maybe it wasn't picked up on. Can you
Mm.
still be diagnosed later in life?
Yes, absolutely. And I think that we're seeing more and more adults who are getting these diagnoses. It's probably hard to find physicians who feel comfortable diagnosing it as an adult because it's kind of a newer thing, I think, for physicians to encounter in terms of adults coming in and asking, like, I think I may have this.
Mhm.
However, there are places where you can go as an adult and get the official testing done and have a good assessment by people who are trained to pick it up in adults. So absolutely, adults get diagnosed who just went through life kind of feeling like something was missing or something was different, and then they get that diagnosis later on.
So, when we're thinking about kids and parents, especially, we're speaking to all the moms and parents out there. What signs should we be looking for um, that would indicate that maybe there's an issue? Because again, like that early treatment, getting the therapies is so critical. What should we be looking for?
Absolutely. So, the good thing is now pediatricians should be doing what's called an MChat, which is an early screening tool that pediatricians will do, usually between I think around the 18-month visit for toddlers. And this will kind of pick up on some of those early symptoms. It can be really hard to know in toddlers who are still kind of developing their speech. They're still, they're not fully conversing with us. It can be kind of hard to pick up on, especially the more subtle symptoms. And so the MChat is a really good screening tool that picks up on some of those. And a lot of the ones, I won't go through the whole thing, but a lot of the things that are on there, I mean, it could be something as simple as poor eye contact, but that's not required. You can have other things and still have autism. So you can have a baby with autism who makes pretty good eye contact, but
Mhm.
no eye contact or limited eye contact. Limited sharing of experiences with mom or dad. So even at 18 months and with very limited speech, babies are prone to pick up something they find that's cool, a toy or something they're engaged with, and come and show mom and kind of share in that experience with mom. So there's that may be blunted or limited in kids with autism. Another one is called joint attention. So as a parent, you can say, "Hey, look at the bird in the tree," and you point up. And most in typical development, an 18-month-old or toddler is gonna follow where you're pointing and look for the bird. And children with autism, that may be absent, or they may like look at your finger, or but there's a deficit in that kind of what we call shared attention. Yeah. So those are just a few things. Pretend play is another one. So tea
Yeah.
parties, feeding the baby dolls, cooking food, like the little pretend play that we see toddlers engage in. Sometimes we'll see kind of a deficit in that in young kids with autism. Yeah.
Okay. So, thinking back, like I have twins and they're 14 now, but thinking back, like we just, moms, we don't want to think that there's anything, off or wrong or, with our child. And um, what is your encouragement to parents? Like if you're maybe seeing some of those signs, um, what is their first step? What should they do to kind of head off or what would be your encouragement to them? Because I think it's
Yeah.
scary.
I think definitely first step is to bring up any concerns with your pediatrician. So pediatricians are really good at, picking up on some of these things and referring out for more testing if needed, or providing reassurance if they don't see any of those signs. So always, I would say, always bring any concerns to your pediatrician. I have an almost 14-year-old, and when he was a baby, his speech was a little bit, behind, or at least what we thought it should be. And this probably outs me as an anxious physician who's kind of looking kind of overly worried about those things. But we brought that concern to our pediatrician, and She was like, I think it's fine. I think he's still within the normal range, but she did refer us for a speech evaluation. And so it's just, I think that's what pediatricians are there for. They know kind of what the normal range is, and they'll get any referrals for you that you need. And I just encourage parents, your kid better than anyone. And it's okay if you're like, oh, am I worrying too much? It's always better to err on the side of caution and just bring those concerns to your doctor.
Yeah, I think that mom instinct, that parent instinct, there's something always in our gut
Yeah.
that, is saying, and your pediatrician, such a valuable resource, obviously, but they only see you for, once a year,
Hmm.
possibly, or, earlier, I guess, when they're younger, but, for not a very long period of time. And so, trust your gut. So I
Yes.
think again, like that speaks to kind of the mom anxiousness. So let's say your child is diagnosed with autism. Again, there's that spectrum. What is your encouragement to them of being able to live a quote unquote normal life or not as modified? What does that look like?
Yeah, I think it's so, again, every child with autism is so unique, and they're all going to have their own challenges and their own strengths. And so, with parents that I see in my clinic, parents of children with autism, when they ask like, what can I expect, or what, will they never have a job? Will they never live independently? I always say we're going to aim for the highest level of functioning, and we're going to just assume that they are going to shatter all of our expectations. So we
Mm.
go into it with that kind of outlook, and we're going to get all the supports and all the therapies and every intervention that we can to ensure your child has the best chance at success. So it's, I have heard multiple times from adults with autism, and even on programs that you watch, that, parents will say, oh, the doctors told us he'll never do this, he'll never do that. And look at what he's done. And so I really try hard not to say those things, even in the children who have pretty severe um, symptoms and impairments, and are really struggling, because so much can change as they mature and get older. And these kids surprise me all the time. And so I'm always like, let's not put any limitations, or especially negative expectations. Let's just expect that they're going to, shatter all expectations and go into it that way. And I feel like, the parents who do that and kind of raise their kids like, no, you can do this. They kind of have more of the pushing and like wanting their kids to kind of try to do things more independently, pushing them out of their comfort zones. Those are the kids that, later on I'm like, wow, look at where we were, and look at where we ended up, and all of the different things that you've been able to do. So I know that's not a specific answer to that question, but I'm
Well, no,
very careful, yeah, to
I think that's such a hope-filled message,
yeah,
because I think things are changing every day, right? And
yes,
new therapies, new treatments are coming out, and
absolutely.
uh, my daughter was born with a heart defect and pretty severe. And the doctor, when she was still in my belly, she told me, she's like, she'll probably never play sports
Mhm.
and do all those things. And so much has changed for Quinn. And she plays basketball and she does all the things and she's has so much energy. And so again,
Wonderful.
like no limits on our kiddos. And so kind of speaking to the medications and therapies, are there specific meds for autism? What does the therapy regimen look like for that?
So as of now, there are no medications that treat the core symptoms of autism. So social communication deficits, the repetitive kind of patterns of speech and behavior, the sensory issues. So there aren't really any medications as of now that have been FDA approved, or even really shown in a lot of large studies to be helpful for the core symptoms. though, I'm hopeful that, we will see some things that are developed that may show some promise. There are some things that are being studied right now that are showing some promise, but really the core treatment for those symptoms is behavioral therapies. So teaching, which work on, teaching children how to kind of cope, how to maybe develop different patterns of interacting, so that they can, communicate with their friends and make friends, and, knowing the difference, for example, this is real specific, but knowing the difference between like formal interactions and very casual interactions, kind of teaching them the rules
Mhm.
of social interaction. So the things that for a lot of us are kind of innate, or we just are intuitive, we just know, those can be really hard. Like, how do you start a conversation? How do you introduce yourself? Just the back and forth of conversation. So a lot of behavioral interventions that are kind of focused on teaching kids just how to engage with the people in their environment. And kids who get early intervention with those behavioral therapies really show pretty impressive improvement over time. So
I mean, I think that's so important. I think it's actually important for almost everyone to do some sort of like
sure.
social interaction things, but that is so helpful that there's therapies and those things can work.
And I will say, sorry, I didn't to touch on medication. It doesn't mean that medications aren't used in autism. They
Right.
are, but they are used primarily for kind of associated symptoms or comorbid stuff. So comorbid meaning this child also has ADHD, or this child also has severe anxiety. We do have some use for medications in those cases, but for the core symptoms of the social communication, the medicines just haven't yet been shown to be that effective. So yeah.
We will see what happens in the next
Yeah.
couple of years. I think that again, so important why we're talking about this. Because the more light we can shine, the more eyeballs, the more understanding there is from the general population. I mean, I've even seen where my kids, being in middle school, they understand that they have some friends and they just understand that they're just a little bit different, but they have so much sympathy, or I guess empathy would be a better word.
Mhm.
And so the more that we can talk to our children too about it. Um,
Definitely.
Last question. So, obviously for a parent, you have this baby and you have these expectations and what it looks like for you as a family and these dreams. And then it's, shattered a little bit by maybe a diagnosis. What kind of support is there for like caregivers? I mean, because this is a very intensive, this is a lifelong thing.
Mhm.
What kind of support for parents, for grandparents who are caring for these children?
So yeah, the good thing is, I think that autism awareness has definitely grown in leaps and bounds over the last few decades. Certainly from the time I started working to now, it's just more. I just see it more in just in everyday media. I mean, people are talking about autism. I think that's wonderful, because I do think with that, parents have much more they can kind of tap into in terms of just seeing, depictions of other families that deal with this. But one of the go-to supports that I recommend for patients and parents is Autism Speaks. It's a huge organization. They raise a ton of money for research. They do all kinds of different activities and fundraisers through the year, but they also on their website have links to kind of local support. So if parents want to get involved with like a group of other parents, and that's more local, they can, or if they want to get involved in advocacy with Autism Speaks, they can. So I think that's a really good place to start. I also have a ton of kids who are involved in Special Olympics, which is not specific to autism, but it is kind of an outlet for a lot of kids who have either intellectual disability or neurodevelopmental disorders. And every patient I have who's involved with that absolutely love it. And you don't have to have any athletic skills, but that's another one that I have a lot of parents who are involved with who really feel like it allows them to meet, other families that provide support.
I think that community aspect is so important where you don't feel like you're on an island.
Yes,
That you need to feel like, that there's hope, you're not alone, and also have a place to go and weep and mourn a little bit too, is important, to be able to kind of come to terms with that. So we
definitely.
shared a lot of information in a pretty short amount of time, um, but we are going to drop some links below on how you can. Number one, find if you don't have a pediatrician that you love, know, and trust, we're going to drop a link so you can find one at UTMB Health because that's where it starts. So that you have a build relationship, and then we will also drop psychiatry in the box below. We'll do Autism Speaks, so that you guys have some resources. Of course, as always, if you have any questions, please also drop them below and we'll circle back with the UTMB team. But thank you so much for joining us and being such a wealth of knowledge during this very important month.
Thank you. Thank you for having me.
Yeah, it was a pleasure. Y'all, we'll be back next month with another important health video, and that's timely. It'll actually be May is Mental Health Awareness Month. So we kind of talked a little bit about mental health today. We will be diving more into that next month. Until then, we will see you.